everybody, I am that nursing prof and welcome to my channel. In today's video, I'm going to be answering that universal nursing student question that we all think to ourselves at least once, and that is, am I dumb? Am I not smart enough to be a nurse? Spoiler alert, the answer is no. No, you're not dumb. So in this video, I'm going to explain why you're not dumb and what are some things you can do to improve your grades. So you might be thinking, I feel dumb because I ask too many questions, or I'm always the one that's raising my hand asking questions in class. That is not dumb. Asking questions is not a dumb thing to do. In fact, it's a very smart thing to do. It's part of the critical thinking process. So that's actually a really good thing that you're doing that. We do not expect you as students to be experts at everything. I know sometimes it might feel that way, but we really don't. What we expect is for you to show up, to try your best, and to actively really want to learn the material. That's what we want from you. And it doesn't mean you're dumb, it means that you're trying, and that's a good thing. Give yourself a break. Don't be so hard on yourself. All of those negative thoughts, it's impossible, I'll never understand it. Get rid of those, okay? You want to be positive. A bad morning doesn't mean you're going to have a bad afternoon and a bad evening. So one bad test does not define who you are as a nursing student. It doesn't mean that all of your tests are going to be bad. So do not define yourself by your failures. Have a positive outlook and try your best. Being dumb and being overwhelmed are not the same thing. So you might have been thinking, oh, in my previous courses I was taking, 6 credit hours and it was super easy. Now I'm taking a full load and I feel like an idiot. You're not an idiot. You didn't just become one overnight, right? You have too much going on. So you got to know your limits. And it's okay to have limits and to put those limits on yourself. Be honest with yourself about what you can and cannot handle and make adjustments as necessary. It really all does come back to A&P, your anatomy and physiology. So if that was a course you struggled with, or maybe you just haven't taken it in a couple of semesters, it's been a while and you might have forgotten stuff from it, go back and review it. Review your notes, review the terms, review the book even, because you need to understand the basics, the normal stuff, before you can get into a med surg and understand the abnormal stuff. For example, if you don't know how the heart functions normally, when you start talking about CHF, it's going to be that much more difficult for you to understand. So knowing the normal stuff is going to help you understand the diseases, illnesses, variations, things like that when you start getting into your other specialty courses. Don't be afraid to ask for help. Ask your professor, ask your advisor, ask the tutor. It's literally our job to help you. That's what we're here for. So if you need help, just ask. You want to join a study group. And not just any study group. You want to find the people that are doing really well in your class and join their study group. And I know you might be thinking, well, isn't that going to make me feel even more dumb being surrounded by all the smart people? But it won't. It really won't. If anything, it will force you to kind of elevate and rise to their level. Also, some things, you'll notice how they study. Maybe they do something a little bit different that you've never thought of. Maybe you can try and adapt some new routines or some study habits into your practice, and that's going to help you find out what works best for you and how you can best study. Do you need special accommodations for test taking? Maybe you understand the material, but when you get into that classroom setting and there's the pressure and all of the noises that are normally happening in that classroom environment, maybe that's too much for you. Maybe you need just a little bit longer, a little bit more time to take the exam. All of these things are perfectly reasonable. So every school should have accommodations for these types of things. So whether it's something like just giving you earplugs or having you test on a separate day or coming in a little bit early to test so you can have more time or even doing it in a separate room. All of these things are reasonable and we can do them. So if that's something you feel like you need, I would go ahead and ask your school about it and look into it. If you're doing something new in Skills Lab, understanding the why behind it is going to help you accomplish the skill a lot easier. So this is how we do an NG tube, but why would somebody even need an NG tube in the first place? So having that base knowledge of what it's for, how it works, the whole point of it is going to help you to accomplish that skill and do it correctly. Of course, the best thing you should do for this one is practice, practice, practice. So if you have open lab, practice in the lab, or if you're at home, just use common objects like a shoebox or a pop bottle or something like that. And you can use those as your patient and you can practice your skills. Of course, we also have YouTube videos for you to watch. You can team up with a friend and watch them do it. And then also, I really recommend this because as students, you are considered linear learners, which means you learn things step by step and you memorize them in order, is physically write out all the steps to the skill. Step 1, wash my hands. Step 2, provide privacy. Memorizing it in that order is going to help you to do better when it's time to actually do skills checkoff. You want to set goals for yourself every single day, every week, and for the whole term. An example would be, today my goal is to read this until I understand it. That is a perfectly reasonable goal that any of you can set. And if you are having a hard time understanding things, look for alternative ways to learn. Using mnemonic devices, watching videos, creating, silly songs in your head so you can remember, or using analogies that you understand. These are some ways that's going to help you to learn this information. And then finally, I wanted to tell you, you're not the only one that feels this way. Your classmates feel this way, even if it doesn't look like this. Anybody that's ever been to nursing school has felt this way at one time or another. It's okay. So you want to acknowledge the obstacle, but you want to have faith and trust in yourself that you'll be able to overcome it. So that was my video. I hope you found this helpful. I hope there was some encouragement and you don't walk away from this thinking, I feel dumb, because you're not dumb, okay? You're not dumb. If you take anything away from this, that's what I want the takeaway to be. Don't forget to like and subscribe. If you have any questions or comments, please let me know. And if not, I'll see you on the next one.